Endoscopic intermuscular dissection for deep submucosal invasive cancer in the rectum, a new endoscopic approach. Introduction. Deep submucosal invasive rectal cancer is considered an indicator for total mesorectal excision, TME. However, recent reports have shown that deep submucosal invasion is associated with low rates of lymph node metastasis when high-grade tumor budding, lymphovascular invasion, and poor differentiation are absent. This limited risk must be balanced against the total mesorectal excision mortality of 1% to 1.5% and post-total mesorectal excision recurrence of 3% to 6%. A local excision of a suspected deep submucosal invasive rectal cancer as a total excisional biopsy can therefore be seen as a first step to organ preservation. Endoscopic submucosal dissection, ESD, for superficial invasive T1 cancer can provide high R0 resection rates up to 92%. However, the deep margin R0 rates drop to 62% to 64% when deep submucosal invasion turns out to be present. Transanal endoscopic surgery usually comprises a full-thickness resection. While superior control of the deep margin is obtained, a full-thickness excision distorts the embryological plane for future completion of total mesorectal excision, particularly in rectal areas with minimal fat coverage. After transanal endoscopic surgery, completion total mesorectal excision was associated with an increased reintervention rate and incomplete mesorectal excision, and impaired quality of the total mesorectal excision specimen due to extensive fibrosis. Endoscopic dissection in between the inner, circular, and outer, longitudinal part of the muscularis propria was recently described in rectal lesions with severe submucosal fibrosis. Dissection through this intermuscular space would enable the attainment of R0 deep resection margins for T1 rectal cancer with deep submucosal invasion, while securing the integrity of the rectal wall, leaving possible future total mesorectal excision planes intact. In this study, the authors report on the technical feasibility, R0 resection rate, and short-term clinical outcome of this new approach called endoscopic intermuscular dissection, EID, for T1 rectal cancers with optical suspicion of deep submucosal invasion. Methods. In this prospective cohort study, the data from patients treated with EID for suspected deep submucosal invasive rectal cancer between 2018 and 2020 were analyzed. Study outcomes were the percentages of technical success, R0 resection, curative resection, and adverse events. Results. 67 patients with a median age of 67 years, and of which 73% were men, were included. The median lesion size was 25 millimeters. The rates of overall technical success, R0 resection, and curative resection were 96%, 81%, and 45% respectively. Only minor adverse events occurred in 12% of the patients. Conclusion. EID for deep invasive T1 rectal cancer appears to be feasible and safe, and the high R0 resection rate creates the potential for rectal preserving therapy in 45% of patients.